As you'll see there, we'll hear from Rod and we'll hear from Martin with plenty of questions and contributions from Colin McEntee. What we'd like to start with now is to take you through the contact stage guidelines. These were first published on the June 25th, but they were updated on July 17th. These have been submitted to all club honorary secretaries, and we hope that you've received your copy of it by now. If not, we'll be making that and some other documents available to you after the end of this webinar. So we'll just move forward. The contact stage guidelines, there's the one pager, but actually when we break it out, we see that really what's it about is about a responsible return to rugby and how we manage contact over the coming weeks. From individual contact skills into team contact skills, into match contact skills, and building forward to the competition stage. Taking a look first off at the individual contact skills, we'll see that very much the emphasis here is on minimizing face-to-face contact. It's about controlled contact development, and that's from as of yesterday, and many of you will be going back training for the first time this evening, right through to August 2nd. The focus is all about the individual contact skills and really just one-on-one contact scenarios. Moving through then into the team contact skills and indeed the match contact skills, we see there's building, continued graduation, modified hit outs up to 10 or 15 minutes, and we're limiting face-to-face contact. And even in the tackle, obviously there are a huge amount of safety reasons why we want to lower the tackle height, but World Rugby actually said that one of the reasons to do it now is around COVID-19 mitigation. So building those contact skills, working through the unit skills, and then on into the match contact skills, where really we're getting into elements that reflect the 80-minute game. We do look to limit face-to-face contact where possible, and we are working towards the fact that in that last section of the match contact skills section, there may be some friendlies taking place as the provinces move into the competition stage on September 5th. To summarise around some of the key behaviours that we're also looking for in this stage, always we go to know your role, show respect, and go train well. What do we mean by that? You need to know as an individual your roles and responsibilities in preventing the spread of COVID-19. You need to show respect to your clubmates and your teammates by implementing that knowledge in showing respect, adhering to public guidelines at all times, and also calling out unsafe behaviour when you see it as well. What's really important as part of this is that we want you to go train well and go enjoy training. Everything that we're doing right now is about being able to go and do that. And a reminder to everyone at club level that nobody can resume any activity whatsoever without having their COVID-19 safety plan complete and submitted to their provinces. We'll move now into the presentation element of this, and I'm delighted to welcome Dr. Rod McLoughlin, IRFU Medical Director. Rod, good afternoon.
Good afternoon, Ross. Thank you very much for the invite. I'm just going to share my screen now.
All good, we can see that, yeah.
Okay, so today what I'd like to talk about is two of the things, the factors that have hugely influenced the nature of how we are planning our return to train and then eventually return to rugby. So the first thing I think to remember is we're all here about performance and enjoyment. So everything we are going to talk about is ultimately so that players perform to their best and enjoy themselves. And the two influencers are obviously COVID and injuries. So if we just look at COVID, the whole strategy that we have laid down is around mitigating the risk of spread of COVID. And the reason for that is if we have COVID in teams, they will be shut down. Public health will shut them down. And if enough teams are shut down, that will lead to leagues being shut down. So we are trying to mitigate the risk of that happening. The other thing around COVID that we need to consider, and that has influenced how we return back to train and to play, is some medical considerations for those that may have had COVID. There is some evidence that people might have some long-term sequelae. So we need to do it in a phased, safe way such that we minimize the risk of any of these people developing any significant complications. The other area that I've talked about is injury. And this is different to any other pre-season. Because of COVID, it has had two significant influencers on the off-season. The first one is that we have had a length of an off season that has been longer than any other due to the restrictions. So because of that, that is then clearly a consideration around the risk of injury being developed in players who have been off for a longer period of time. It has been compounded by not only have our players been off for a long period of time, during that period, they have been restricted in the activity in which they were allowed to partake in. So, you know, for a long period of time, you were limited to within 2K, you were limited in terms of you were only to leave the house for 40 minutes. So the summary of this is that we have an off season longer than any other, compounded by a limited activity like no other. And we all know that the risk of injury is greatest when there's a rapid change in load. So these are all the things that lead us to this graded return being much more significant this year than any other year. So, and I suppose that's the message. The message is that we are looking to have greater return in summary because of a COVID risk and of the risk of injury within people. And as I say to people, I don't know that any players enjoy themselves performing injured or either perform to their best.
Thanks, Rod. And hi, guys, it's Colin here. I'm just going to intervene and ask Rod a few questions, if I may. Rod, obviously the clubs are opening up this evening, part of a pre-season. And it is a different pre-season because we do have COVID alongside us. And you spoke, Rod, about mitigating against the risk. Can you just inform a little bit more of why a graded graduate return? And if I'm a coach and I'm looking at, you know, the various elements of what I can do, and you say limited face time, etc., why is that so important at this moment?
I think when we use the word graded, there's sort of two parts to this. There's a normal thing we're all used to, the graded introduction of activity in somebody at the beginning of a season. But there's also this graduation of the introduction of contact and closeness to people from the point of view of COVID. The three things we've been told all along to do to manage COVID have been to socially distance and to follow cough etiquette and hand hygiene. And now the other thing that's coming in is the use of masks. So we're introducing two things here. We're introducing an increase in activity, but we're also grading the nature of that return to activity. The greatest risk from a COVID point of view is when teams come together, when they haven't been together for a number of weeks. You know, for all we know, we could have players who've been away and are back from holidays. For all we know, we have players who could have been unwell last week, but are now recording that we're well. We could have players who are slightly unwell and don't realize that it's something developing. So that's the basis whereby we then do the greater return, that is the COVID part of it. In other words, come back in small groups. Well, firstly, come back only if you're well. Come back in small groups. Do activities that keep that you're staying 2 meters away from one another and therefore limiting your risk. And as we become more confident that people are well, we introduce more challenging things from a COVID point of view. You know, we move to activities that involve some contact to closer levels of contact. But as around now is the time of the greatest risk, I think it's interesting if you just look what happened in the Premiership. They did their testing of players, and when they did a pre-contact, they're now picking up positive tests, and a significant number of those positive tests have become because of people's behaviour outside the performance environment. So one person was at a wedding, one person was in the pub with his friends, another guy played golf, clearly not social distancing. So the other thing I would say about this is, Golly, is it is equally important that our behaviours are appropriate outside the field of play and the training as they are inside it. Your risk is probably greater in normal life than on the field of play. So it's about a vigilance in both areas.
Yeah, okay, Rod, another question that what, you know, you're saying about, you know, limit face time and stuff, and we do, and it's part of the IRFU protocol that players have to do a self declaration assessment to ensure that I'm okay. So I'm ensuring that I got 20 guys down training tonight. They're all okay. Why can't I do more?
I think it's because it's probably more correct to say they all think they're okay, and I don't mean that in any negative sense to them. Early in the disease, so most people get the disease after 4 or 5, so develop symptoms, I should say, 4 or 5 days after they get the disease. And that's the thing, what we call the incubation period. But during that period, they may pass it on. So that's why, even though I declare and come along and say, I think I'm fine tonight, that we would say you limit your FaceTime, you limit contact. Because just back to that point, the high risk activity is me being face to face and close to you. Because think about it, I spread the virus in my droplets, in my sneezing, in my coughing, and even some evidence in loud speech. So that's what we want to limit. Now, when they come back and train a few days later, we now have clearly that they've at least been well and declaring that they're well on a number of occasions in the 1 week. But it's not a foolproof method. But it is back to this idea that just because I feel well doesn't mean that I couldn't be transmitting the virus.
Okay, I'm going to leave a very quick one before we shoot over to Martin. But I trained tonight, everything was perfect. I follow all the guidelines, and Martin's going to give us an insight. What happens if I get informed tomorrow or the next day that someone has picked up COVID and we don't know where it's from? What do I do then as a club? As a club,
if somebody has been diagnosed with COVID, there'll have been a doctor involved in that somewhere, be that the family doctor, be it a hospital doctor, whatever. And they will have contacted public health. So public health will then make a risk assessment, will decide who are the close contacts of that person. So public health will make the decision about, you know, oh, you played rugby there, you had rugby training last night. We need to look at that and decide how many people we have to put into isolation. And it is that very reason that we're going back in this phased way. So if that were to happen, that then hopefully they come to the club and go, well, actually, you were in pods. So at most it's the group, that the pod that you were in. Well, actually, you're at the phase of whereby it was social distancing running. So actually they might say, you know, you were safe and it's only you. But public health will take over that. But we're trying to do things that mitigate and minimize the number of people that they will exclude. I think the other thing important that people understand about this return, evidence will show you are 18.7 times less likely to get COVID from somebody who has it if you interact with them outdoors than indoors. So you see our strategy has all been around outdoor activity. It is much, much safer from a COVID point of view.
Thanks, Rod.
That's great, Rod. Thank you very, very much. A reminder to submit your questions using the chat function. Lisburn have a question in around when internal squad games are permitted. We'll get to that in just a little while, but we'll move on now to Martin Kennedy. Martin is going to chat to us now about performance, injury reduction and return to play after prolonged inactivity. Good afternoon, Martin.
Good afternoon, Ross and folks. A pleasure to be on the call and great to support this initiative. So I'm just going to go through an outline, a high-level outline, if you like, of performance, injury reduction and return to play. So I think the key piece to start with is why is this important? And Rod in the medical overview, if you like, gave us all an insight and a snapshot of that. Well, it's optimizing performance. It's working backwards from September, when we're going to be back playing matches, and just getting physically, mentally, and every way ready for that. It's protecting players against the risk of injury and getting that balance between avoiding under training, but also avoiding overtraining as well, and having the load too excessive. Because ultimately, all of you on the call, all the coaches, you want players back enjoying training, number one, and then playing and being available to play and be selected to play when it counts most in September and going forward. So if you like, it's just trying to get that balance, that seesaw between developing their fitness and just managing their fatigue as well. So questions to bear in mind or have at the front of your mind, if you like, is, and you guys know your own players best, you know, how much has a given player or your squad trained over the last few weeks? That's going to give you a snapshot around what they can potentially are ready for with your sessions and how you plan and design them. And then from a management of fatigue point of view, you know, how hard can you actually push them this week or in this given session? What stage are they coming into the session in? How hard are they trained in the weeks preceding? So that context, if you like, is going to help with the following piece, which is around planning. So planning is all about it's about getting ready and doing it in a smart way. So 4 key things. Less is definitely more initially. So we're really advocating gradually progressing and adding challenge both to the sessions and to your training weeks as you build up towards September. Warming up well, so setting the tone for every session that you're doing and protecting time. Again, we're advocating a minimum of 15 minutes, maybe even up to 20 minutes of an extended warm up and a ramping up of what you're going to do. Follow best practice, adhere to that, and really try and zoom in. What are you trying to achieve in a given session? What tasks and activities are the players going to be exposed to, and do you want them to perform very well at? And putting in planning for little opportunities within the warm up to address those and warm the players up physically, but also technically and psychologically as well. Increasing the training load over the course of a few weeks in a planned and a controlled and a deliberate manner, building up again to the loads they're going to need to be able to tolerate come game weeks. And using tools such as the training intensity scale that we'll share with you shortly, just to help support session planning and also to get a better understanding around how your players are responding to this training stimulus. And as Rod alluded to, they're coming into the clubs in a totally different state than they would have done previously, as well psychologically, emotionally, and also physically. There's going to be huge diversity in experiences across the whole COVID. So we need to bear that in mind. So the training intensity scale is actually, should be quite a good tool that we'd like to point you towards. A few key considerations, if we could draw your attention over to the right-hand side. How often you train, so the frequency at which you train, so is it 1, 2 or 3 times a week? The duration, so how long are your training sessions? For example, between 40 and 60 minutes. The intensity at which you train, and that scale will help with this. How hard was the session or a given individual activity, and also the volume of the session or activities within that session. So are you doing a passing drill for 2 minutes, 3 minutes, or 5 minutes, or a small-sided game, or a scenario, or whatever the case may be? So being able to have those key considerations, again, on your roadmap, in your planning, at front of your mind would definitely be useful, and it's what we would be advocating. This is the training intensity scale. It's borrowed and adapted from the science, if you like. It's a modified Borg scale, which has been shown and illustrated to, tightly mapped to heart rate. So very, very simply, it's a scale of 1 to 10. From 9 and 10 being grueling, maximal, the hardest session or the hardest match you've ever played, to 0 or 1 where your effort is negligible. So by having a tool, I suppose a simple tool like this for you guys to reference when you're planning your sessions and planning, if you like, the appropriate load in sessions, it should give you more assurance and reassurance and confidence around what you're trying to expose your players to in a gradual and a progressive way. And the flip side of it as well is post-session, when you're reviewing the session, and seeing how the players performed and how the whole session went, you can actually ask individual players, your captains, maybe your leadership group, a select group of players, how hard they thought the session was, and that gives you really good quality subjective player feedback around the load that they would have experienced, what you planned it to be, and what they actually experienced, and that helps them plan following on consequent sessions. This is just a very, I suppose, a crude example, but one I think it's important to share around how you might go about planning. So this is a sample around targets that you might map out for your given squad. So appreciate, everyone is going to be starting off at different levels, and some players may have been training diligently, in the gym, at home, in their home gyms, around their back gardens, on their greens, or whatever for the last few months. Others won't have. But from a team preparation point of view, having a map, an outline like this for the 7 or 8 weeks to start with, for example, up to the games, would be useful and beneficial, and we would definitely advise you to do this. So number one, you're mapping out how much frequency you can have with your group, how many sessions per week, that's that column there. So you're starting with 2 and building up progressively to 3. You have a recovery week potentially mapped in on the week of the 17th. So you've only 2 sessions there, and then you're building back up to your 3 and leading into those games in September. When you move across to duration, and bearing in mind these durations are excluding that protected 15 minutes I spoke about at the start. So your rugby content is, for example, 45 minutes for that first session this evening, for example. 2 sessions this week are 45, and so on, building to 50. Working between 45 and 50 and building up to 60 as you get closer to that, that game piece where you're trying to build players up to be ready and robust and able to perform for 70, 80 odd minutes. The key thing to be conscious of is the relation between duration and intensity. If both are high, the training load is going to be significantly high, and that's where things, I suppose, things can go wrong. If you're on the pitch for 60 or 70 minutes, and it's a very, very hard session, and you haven't been progressively building up to that, that's when players, can be at definitely an increased risk of injury. And we know this from the research that's come out over the last few years. The last two pieces are around setting training goals for both you guys as coaches and for your players. All of this information, as well as the research, we're standing on the shoulders of what the provinces are currently doing in the professional teams and with the academies as they come back to training and come back to performance and preparing for matches. So gradual progressions, gradual ramping up of challenge and activities and intensities and volumes. From a coaching point of view, it's planning that, it's ensuring players warm up well, it's watching their body language, observing even more so than you've ever done before around fatigue and excessive fatigue, and making a call around, Johnny or Mary, you need to step out of this one or this rep, or take a break for a few minutes, get the recovery and go back in. Using tools like the training intensity scale to plan your sessions and then get feedback from them. And also, as part of that graduated return, planning deload or easier training weeks. There's a weekend off and they can relax, recover, rejuvenate, and then go again as they prepare to go back to the games. From a player's point of view, and this is really important, and this goes back to the behaviours Ross outlined as well, it's players' responsibility to prepare as well as they can for the sessions you're working hard to plan out for them, to make sure they enjoy them as much as they can, look after themselves between sessions, be as diligent as they can. Again, from an injury risk management point of view, that's really, really critical. Be proactive and take responsibility for their preparation. Bring their fluids, their own water bottles, their own snacks to recover and rejuvenate post sessions, and use and encourage them to check out existing IRFU and provincial resources on nutrition, on recovery that are there and that are available for all. So that's it from an overview perspective, from my point of view, from a training load point of view.
Thanks, Marty. Just one or two quick fire before we get into Ross. Just relating to load and so we forward, and your start of the slide was about performance. We're not going to be really into matches or real matches and meaningful matches towards September, the end of September, and then things kick off. So building that load is absolutely critical, because when you look on your chart, I mean, people might assume that, and assuming that 10 is where a match is always going to be, is probably not real. And the other thing that you alluded to as well is knowing your players, and the coach's eye is critical. So we could have players that have been idle, or players that have done a fair bit. So for the coach listening to this, and he has a group of 25, how does he, understanding that the end goal may be till September, just managing that load in a practical sense, what should he look for?
Well, you should look for, as a starting point, it's trying to build a really good picture as regards where the players are at, Colin. So it's having that interaction with them now, right from the start, building up that information. It's like the little needs analysis around where they're at, how much training they've done, how ready they are for what, and you're aiming at the lower end of that. So you're aiming at the if you like, the guys who have the least amount of fitness, rather than pitching to the upper level, and you're trying to rise all boats with that. And you can always individualize and challenge the guys that are that bit fitter, but what you don't want is pitch it too high or pitch it to the guys that are fitter, and next thing you've lost 25 or 30% of the group because it's been too hard too soon.
Perfect. A quick one other on Marty. You mentioned there 15 minutes as a warm-up. I'm a coach, and I'm seeing that, and you say 60 minutes of a session. Surely I can incorporate some ball work and stuff?
100%, Colin. 100%. So what you're trying to achieve from that, you're trying to get through some basic bodyweight movements, dynamic stretching, some low-level and controlled running, where they're knowing where they're going to run, they're knowing where they're going to change direction. But then you're absolutely adding in some controlled ball work. Maybe there's some, as we progress into the contact phase, you may plan to integrate some low intensity contact reps in, just so players get used to that prior to going into the more intense version of what they're going to do in the sessions. So 100%, there has to mean, the bottom line is they're coming down to play rugby, but I think critically it's important in the communication to the players pre-session that, guys, we're really going after it. We're going to have a brilliant session tonight, but we're going to warm up really, really well and prepare really, really well for it, so we can, we can enjoy the rugby when we get to it. And that the responsibility is shared as players and coaches for that.
Okay, I'll hand over to Ross for rapid round questions. Ross, if there's anything there, because I'm conscious of time.
Yeah, thanks, Colin. We'll go round the houses here. Gary in Coleraine asks about downloading the charts and templates, and somebody from Anonymous RFC wants us to change the training intensity scale. We will be sharing all of that documentation with you via the email that you used to register for this webinar, and indeed a copy of the video itself for you to go back on. A question in here, the initial question that came in, Colin, might ask this one to you from Lisburn. In the match contact scales, when we want to look at a game that maybe not necessarily be against another club, but maybe A versus B, probable versus possible, when can we look at getting that game played?
I think the lads really highlighted a great at returning. So I would suggest maybe a week before competition starts. So I think we had friendlies then at the end of August. That would be a really good date. I think even myself listening to Rod and Martin, I'd be giving my players 5-6 weeks lead in, because it's a long enough season and there's a lot of matches to be played. So don't overcook the players too early.
We will have a number of other webinars that will essentially kind of fall out of this particular session that will be more tailored towards adult, age grade, and indeed minis rugby. So we can come back to this, but a good question in from Ian around that 15-minute warm-up. Is that advised for mini rugby players?
Marty, do you want to take this one, or will I?
Sorry, yeah, no, yes, it would be. It would be, definitely. Yeah, I think like the kids and that, or the young players, would have kept up some level of activity within their home environment, on their greens and that. But definitely, I think from a habits point of view and a behaviours point of view, I think it's important that we advocate that, and that is advocated across the board.
And from my own experiences coaching minis as well, it's really important and essential that we can make the warm-ups fun, and we can absolutely include a ball, so it becomes part of your overall session. And some, there's a myth out there saying that both are separate. They're not. They're mutually connected, and it's important that they remain that way.
I think just also to come in on that one, and it's a really important point Martin makes, it's about habit formation. You can't suddenly decide at the age of 14 you think warm-ups are important and suddenly expect somebody to turn on when they've been playing rugby. The other point is the purpose of warm-up is about preparation for the activity, and that is both psychological and physical. So it's like anything. You lead gently into something. So don't forget the psychological part of warming up. I'm preparing myself for the activity you're going to ask me to do in about 10 minutes or 20 minutes.
Colin, we're short on time a little bit, but we might hand over to you to go around the houses and take us home.
Yeah, just to firstly to thank everyone that's on the call at the moment. I know at times people might be a little bit frustrated in relation to how sort of graded we are, but I think safety is paramount, and I think for us we have to give that a reassurance as a governing body, as clubs, as coaches, as volunteers, to our participants, that rugby is safe, rugby is a good sport, and we absolutely care about everyone. And I do think, it's a long game here. It's a long game here, and we've seen things happen in other sports, and we've seen restrictions, Rod, open and close and shut in other countries and stuff. And what we're trying to do is to do right by rugby, that we can be a beacon and something that we can be proud of. So just to follow on from what you said, Ross, we are going to follow up with a lot of the more practical content. What does content look like for adults? What does content look like for minis? What does content look like for youth in schools, based on the return to train as well? So keep an eye out for them webinars. And just to congratulate everyone, like we've a massive uptake in relation to the putting in the safety plans, etc., Ross, and we got to be really proud as a sport. I think we're going in the right direction. So just to thank everyone for jumping onto this.
Yeah. On behalf of everyone who's on this, I want to thank yourself, Colin McEntee, Martin Kennedy, and Dr. Rod McLoughlin for taking us through a really useful session today. Thanks a million.
God bless.
Thanks folks. Best wishes.